Hey, my name is Liz, and today we're going to look at a specific area in the nursing note for nurses working in the outpatient setting. Let's go ahead and open up your nursing note by clicking this button. And I'm going to come down here to section number 3, Interventions, and click the button Nursing Interventions. I want to show you guys that you're able to document that the patient has been given an injectable psychotropic medication without having to go through the more involved workflow of using a medication administration record such as the type that's used in the inpatient setting. So we're under interventions here, and you can see you can talk about general nursing interventions. You can talk about nursing education that you've done for the patient, but we can come right down here and let's focus on injectable psychotropic medications in a little bit more detail. I'm going to click this button. It opens up into a shrub, and we're just going to work top to bottom down here. Notice that it's given you a title here that says Psychotropic Injection Given. I'm going to start at the top and say who was my prescribing clinician. I've made some custom buttons for names of clinicians that I would be using in my clinic. Let's just say it was Dr. Jones or Dr. Smith. Here we go. And what medication was injected today. And we've added in here a nice list of, we think, all the injectable psychotropic medications in all the current doses. So I'm just going to come down here and say that we gave, how about Prolixin decanoate, 100 milligrams. I'm going to click this button. And it says Prolixin decanoate, 100 milligrams, comma, IM was given. What site was it given to? And I can pick the left deltoid, the right deltoid, the left or the right gluteal. I'm going to say it was given in the to the right deltoid area. Okay, we can come down here. By the way, you can always, down here I put down no redness or swelling post-injection. So you can always come in here and add some details that you'd like to. Or if there was a little bit of bleeding from the site, you could have put that down, no problem. Let's come over here, and the next prompt that we have is to put down the lot number. If this is a required element in your setting, you can just type it in here. I'm just going to make up one, 5566. Expiration date, I'm going to look on my medication bottle, and let's say that it expires in February 15th of 2018. So I can type that in. And finally, if I choose to, I can say when the next injection is going to be due. And let's just say in 2 weeks. I'm going to say today's December 28th, so I'm going to go for January, maybe January 10th, 2016. Okay. Remember, if there's other information that you need to document about your psychotropic medication, you can free text it here, or feel free to create custom buttons relative to your setting to make your documentation flow even quicker. Okay, let's go back. This is the only information I'm going to document in this particular note. As a matter of fact, I'm actually going to take out the heading interval history, and I'm going to just move psychotropic injection right up here to the top. So it's going to show right at the top from my chart face. We'll look at that. Okay. Now, I could, if I wanted to, come down here and do additional nursing documentation like we looked at in the regular nursing note for the outpatient setting, or I could choose to open up this note specifically for this purpose only. And if you are able to bill for the nurse giving an injection, that can be set up here under the service code, and you can talk to our support team and they can help you out with that information. And otherwise, I'm going to come over here and just compile this note. And it says nursing note, psychotropic medication given. If I wanted to be very specific in the title, I could always alter the title of this note by coming over here to change note title, coming in here and clicking other under subtitle. And it says nursing note, and I'm going to put down just colon psychotropic injection given, or psychotropic medication injection given. I'll click OK. And instead of being done by the therapist, let's go ahead and give the nurse credit for doing this. Nurse Liz, either way. Click continue. And now we have our nursing note for a psychotropic medication given by LPN Liz. Here's the information. Here's your diagnosis. The notes and the risk factors did come forward. I could have elected to turn that off if I wanted to. The only thing I have to do now is to electronically sign this record. I'm logged in as Liz RN, that's why it's showing that particular title rather than Liz LPN. And now your note is complete. We'll go back to the chart face and see what it looks like. And look, it says here, nursing note psychotropic injection, which is nice. And you can actually see the top line here. By the way, for these short notes like this, when you're in the patient's chart face, you can click inside here to turn on this internal scroll bar, and I can actually read this note. Just scroll down and read the whole entire note from right here, right down to my e-signature. There we go. All right.